and welcome back to IVF Unplugged, the honest voice for aspiring parents. In today's episode, we're talking about one of the most significant and sometimes stressful aspects of the fertility journey, the financial cost of IVF. For many, the first thought of IVF is often tied to its perceived high cost. The idea of multiple failed cycles can feel like a financial challenge. Fertility treatment in India has been changing. In recent years, advancements in technology and standardization of processes in fertility clinics have not only helped reduce cost, but also significantly improved success rates. Yet, the emotional weight of managing finances while holding on to hope can still be a very heavy burden, especially for those who need multiple attempts. Our aim today is to break down these costs and provide practical, actionable advice. Joining us today for just that is Dr. Moumita Naha from Prapti Fertility Institute, Kolkata, who will help us understand and navigate the financial side of IVF. Hi, Dr. Moumita, and welcome on board.
Hello.
So let's get started and talk about the first and foremost thing. IVF obviously is seen as a big investment for couples. Instead of the exact cost, could you share what are the broad aspects of treatment that couples should keep in mind while planning financially for IVF?
Okay. So the financial aspect pertaining to IVF treatment is actually a very important thing because, even though the IVF price in India is much less than that of Western country, for a couple coming from middle class or lower middle class background, even that is quite expensive. So before starting treatment, what the couple need is a very clear and transparent financial counseling. That is one of the most important aspects of IVF because they need to know from inception to completion of IVF treatment what is the exact cause of that treatment. Like if a center is offering some package for IVF, they need to know what are the services that are included in the package and what are the services that for which they have to pay extra. Just to clarify a little bit, suppose the IVF package of a center is 1 lakh rupees, but that may not include ICSI charges, which is often required if the husband semen sample is of poor quality. That may not include blastocyst culture, which is often preferred by us nowadays just to improve the success rate. That may not include the freezing charge and thawing charge because nowadays in most of the IVF cycle, we prefer frozen embryo transfer. That means we grow the embryo, freeze them, thaw them and transfer. So these freezing and thawing charges are often not included in the package. So if you keep adding up these costs, the final package will be almost double, if not more than that. So that is a very important thing because they need a preparation, the financial preparation before starting IVF treatment. Because you see, infertility is not an emergency, right? So only after this financial counseling, they can have a complete and informed decision whether they should start IVF immediately or they should wait few months to arrange the money and then start. If they start IVF without the financial preparation, there will be a huge stress during the treatment, which might hamper their result as well. So this aspect is actually very, very important before starting IVF treatment.
IVF can, sometimes feel very costly upfront, but of course there have been advancements in medicines, in lab technology, protocols, and if you could tell us if they actually all of these advancements have actually improved the chances of success and perhaps may reduce the need for repeated cycles and thereby the cost.
Yes. So back in 2014, when I started my journey as an IVF clinician, we used to counsel the patient that the IVF success rate is 30 to 40%. And some of these positive patients would even abort. So the take-home baby rate, that means out of 100 patients undergoing IVF, the percentage of patients walking home with a healthy baby would be 30% or less than that. So back then, it was a norm that most of the patients would require a second or third cycle of IVF. But now Nowadays, we are using better quality injection to stimulate the patient, and there is revolutionary improvement in the embryology part. So the culture media that we are using right now, the incubator we are using to grow the embryos, are much more advanced and modernized. So nowadays we are counseling the patients with confidence that with good quality blastocyst, their IVF success rate would be at least 60 to 70%, and chance of getting an abortion is also much less. So today, most of the patient will not require a second IVF cycle. And another aspect, in IVF nowadays, we try to grow as much embryo as possible. And suppose after first embryo transfer, the patient is lucky enough to get a pregnancy, we can store the extra embryo for future use. So after 3 or 4 years, she can come back and use the same embryo for having a second issue. So in that sense, one IVF cycle can complete her entire family. So, though I do reckon that as compared to the 2014, now the IVF package price is slightly increased, but this increase is not substantial. But given the success rate is almost double, I think the IVF is much more cost effective
the number
nowadays
of cycles has gone down.
Much.
Okay, got it. When choosing an IVF clinic, how important, according to you, is it to focus on the treatment quality, lab standards, trained specialists, their success rate, instead of just comparing the package price?
Okay, so nowadays what patients are demanding from an IVF cycle is a persistent, good success rate, a very ethical and transparent IVF treatment, and of course a good package price, exactly in that order. So the most important thing is success rate. So you cannot compromise on that. So we cannot compromise on the injection quality, the culture media quality, because that would decrease the success rate substantially. And equally important is the second aspect, that means the ethical and transparent IVF practice, because nowadays patients are much more educated and conscious. So they want to get involved in their treatment process. They want explanation of each and every step of IVF. So if a center is offering this kind of IVF treatment with a persistent good result, I don't think patient would mind spending some extra bucks.
Okay, understood. So for couples, how can opting for a better quality medicine or advanced technique improve their chances in the next attempt?
Okay, so when we are dealing with an failed IVF patient, the first thing that we do is to explore the previous IVF record so that we can find a possible cause of IVF failure if available, and so that we can counsel the patient and plan the second IVF cycle accordingly. Yes, with the use of better quality injection, some different protocol, better selection process for sperm, blastocyst culture if not done before, we can definitely improve the success rate in the second attempt. And if the patient have multiple IVF cycles, we can even offer advanced technologies like PGTA, embryoscope, and multiple immunological modifications to have treatment, ERA, etc. These are the advanced techniques to improve the success rate of the patient.
So, doctor, apart from the main treatment process, what are the additional elements like medicines, or it could be diagnostic tests, follow-up care? What are the costs additionally that couples should be mentally prepared for when they're planning their budget?
Okay, so the IVF investigation, the standard investigations that are almost required for almost all patients, if that is not included inside the IVF package, that would cost patient at least 15 to 20,000 rupees. So this is almost like standard package, standard cost of the investigation. After getting pregnancy, however, the IVF, we do not recommend any extra investigations for IVF pregnancies. So the routine investigations, which are common for the normal conception as well, like ultrasonography and some routine blood tests, are often recommended for IVF pregnancies. Coming to the oral medication, the oral medications, if not included in the IVF package, that would cost patient on an average 6,000 to 7,000 rupees per month, though it is individualized and can vary from patient to patient. But on an average, it is 6,000 to 7,000 rupees per month. But the important thing is that after getting pregnancy, most of the doctor would continue this medication at least for 2 to 3 months post pregnancy. So even in pregnancy, patient need to bear this cost, that is 6 to 7,000 per month at least for 2 to 3 months. I'm calling this extra because these medications are not prescribed in normal conception. However, after 3 months, most of these medicines are stopped and the patients are given the routine medications just like normal conception, that is iron, calcium and folic acid.
Okay, great. Thank you so much, Doctor, for joining us on IVF Unplugged, helping us understand the varied costs associated with the IVF procedure. Of course, IVF Unplugged, as we know, is the honest voice for aspiring parents, powered by Merck. We hope today's conversation has given all of you the clarity, comfort, and confidence as you take steps onto your next journey to parenthood. Remember that every story is unique and you are not alone. Until next time, take care.